Hi, my name is Dr. Eboni Cornish, and I'm very excited about this topic today because it's something that I see on a regular basis here at my practice. And I've been treating mold for about 10 years now, and typically I would focus on more of the physical symptoms associated with mold illness, things like chronic fatigue, shortness of breath, headaches. But over the past few years, I've run across more and more patients who definitely have a neurological impact from this illness and specifically psychiatric component. So today's talk, we're going to not only discuss biotoxin illness and why it's important, we're going to refer to some of the things that become worse when someone suffers from biotoxin illness, what things we should be looking for as far as clinical symptoms and signs, and more importantly, what the treatment is going forward for this patient population. So, just a quick overview of mold illness. 50% of buildings have some sort of water damage, and that water damage can lead to retained moisture. And that's where the problem starts because those that becomes an ideal medium for those toxic mold variants, and they start to rapidly grow and produce mold spores, and the mold spores are what carry the toxins. So it becomes something called sick sinus building syndrome. So it allows for these indoor molds to grow without competition from the natural element. This does not refer to the outdoor molds because we have hundreds of species of outdoor molds. We also know that these toxic black molds can cause allergies, and depending on the genetics, one person can be in that water damaged building and be completely fine, whereby another person is suffering from debilitating symptoms related to this toxin, and that's usually due to genetic variants. So, in order to better understand why mold and toxicity can cause chronic symptoms, we're going to make it very simple. Inflammation and toxins cause chronic stress, and stress makes a huge impact on our body, not only on our sleep cycle, so you get this non restorative sleep, that also can lead to perpetuation of the disease process and can be associated with a compromised immune system, oxidative stress, decreased resistance to infections, and decreased healing. So I think of mold as this invisible attacker of the brain, and it's usually not visualized with the naked eye. I commonly hear patients tell me all the time, oh no, my home is completely clean. There's no mold anywhere to be found. And sure enough, it's in those areas that you can't visually locate it. So some of the common places are crawl spaces and basements and attics, behind the wall, under a sink, components of the air conditioning system, or even ductwork. And people can find it in different environments that they are in often, like your car. I have patients who've done air cultures for mold in their car, and have found that that's been a culprit in the workplace, schools, garages. But if you suffer from those genetic variants that prevent you from detoxifying mold, it only takes one exposure for you to harbor those toxins and become ill because these spores disseminate very easily. Here are the bad guys, all right? So as I stated, we're not talking about outdoor molds. We're specifically referring to the molds that produce these toxic spores. Stachybotrys is the most commonly known black mold, and then Penicillium aspergillus, Achitomium alternarium, fusarium, among others. So these are kind of those culprits. Those are the molds that, when they're found in your environment, may, if you do suffer from bile toxin illness, make you ill, and to be the ones we're looking for. And they produce numerous toxins as listed here. And those are the toxins are the things that are neuroinflammatory. So why does that even become a problem? Well, the key thing to understanding how these toxins are retained, you must understand the basic liver detox pathways. And the basic pathway, you use your liver, you use your bowels, you use your urine. So through the kidneys, through the stool, through the gut and the liver and gallbladder, that's how you push out these nutrients, because whatever we ingest, we must clean out. So I love this diagram because it illustrates that. So let's walk through the functions of detoxification. And more importantly, I'm going to point out how some people get into trouble and what can make a person more likely to retain mold toxins. So everything we know is toxic. What we eat, breathe, smell, touch. And those toxins enter our body and are found in fat. So that's called lipid soluble. So all these toxins we ingest, they're found in fat. You can't really pour fat down a drain. So in essence, what we need to do in our body is convert that fat to water so that it's cleared out the bowels and via stool and the urine. So the liver has been, it's a great at producing enzymes that help to break those fatty toxins down. And then in the second phase of detox, you allow for water molecules to be added to that fat toxin so you get rid of it. That's what will happen in the ideal world. In a perfect world, when you have toxins, you'll go through these two phases. The first phase, you would break everything down by having all the different enzymes and vitamins and nutrients you need, so that you then go over to phase 2, which is what we call the conjugation phase, where you have the right genes and methylation and cleared out. Well, the majority of patients, unfortunately, that suffer from mold illness, they have blockages along this detox pathway, either with this first phase, so they can't convert that water to that fat to water due to a lack of some of these enzymes or cofactors, or a lack of antioxidants. So instead of going over to phase 2, that same toxin just circulates. And that's where you start getting the tissue damage, because you can't flush it out. It's stuck and it's circulating. Or there's a problem with phase 2, where some patients can't use what we call methylation, all right, which is the body's ability to detox and turn on and off genes and produce different proteins, and sulfation. So those toxins are stuck in the second phase, which kind of leads to a backup. So once again, you have these toxins that are just circulating without being excreted. And that just leads to more and more inflammation. Now, this biotoxin paradigm was first discovered by Dr. Richie Shoemaker, who is one of the pioneers in mold illness. And this, when I saw it, it just resonated and it clicked, because it explains it so simply what happens when your body is under attack for biotoxins. So let's kind of walk through this. So the body produces biotoxins from everything, including mold. And most of the time, the biotoxins are removed from the body, and you're fine. You clear them, They're either in the blood or the liver and attached to the immune system, and you have the right immune responses, and they are cleared from the body indefinitely. However, some people who have genetic problems, which makes it so that they can't detox properly, instead of going through the pathway here where toxins are cleared, they go through this pathway where you start having toxins that damage receptors in the brain called the hypothalamus, and also having a decrease in key hormone production, one of which is called MSH. And when that is low, you're going to have a whole host of issues, including sleep disturbances, chronic pain, GI issues, inflammatory problems, problems with blood flow, and then a compromised immune system, all because you are unable to remove toxins out of the body, and specifically the bile toxins produced by mold. So the paradigm allows for physicians to better understand what blood markers you should be looking for in order to assess for a patient's underlying inflammatory burden due to biotoxins. And here are the genetic causes of toxic overload. So HLA-DR, 25% of the population, the general population, has this predisposition, which leads to an inability to clear biotoxins naturally. So those are the people who go down that pathway that I alluded to earlier, where those inflammatory toxins have that negative impact on the hypothalamus, that part of the brain. Also, something called methylation disorders, or MTHFR. So in these patients, they're unable to methylate folic acid and B12, and it leads to cell membrane impairment and problems with DNA synthesis and problems with detox. And then other genetic variants that can lead to what we went over earlier, that phase 1 and phase 2 detoxification impairments. I love this handout and this visual because it provides a really good overview of the different areas that toxic mold can impact: the brain, the cognitive, the respiratory system, the body, as well as the mood. So here are some specific symptoms as it relates to biotoxin illness. So when I hear some of these classic signs, I put mold illness at the top of my, or close to the top of my differential diagnosis. So a patient who has multiple chemical sensitivity, can't tolerate any treatments, foods, fragrances, react to everything. Electric shocks or currents. Some people say, oh, I have this static shock. I'm feeling it, these jolts all throughout the day. Neuropathy, if persons have numbness and tingling and other neuropathic symptoms. Twitching, random sporadic muscle twitches. And then temperature irregularities. That person is extremely hot and everyone else is cold, or vice versa. The key thing I find in my practice, because I do treat so many patients who have functional medicine imbalances, is that mold makes everything worse. And what I mean by that is because mold is so inflammatory, it makes it so that you have more of a challenge from healing from other conditions like gut imbalances. It can make dementia worse, chronic fatigue, mast cell activation. It can make infections worse, electronic magnetic sensitivity, and chronic inflammatory response syndrome is a result of mold toxins. So it's one of those things, if a patient is getting clinically stuck when you're trying to treat one of these common functional imbalances, you got to think about mold as a potential contributing factor, and that toxicity causing so much inflammation that it's hard for you to treat these other underlying conditions. So I always say mold needs to be ruled out early in a lot of my patients who suffer from chronic symptoms, because surviving mold and getting that one toxin out the way can lead to significant therapeutic gains with a patient that you may have been clinically stuck. And it's on a daily basis that I see a patient who may present to my office being treated for chronic infections or histamine issues, or working with psychiatrists having brain fog and chronic fatigue. And they've been on years of treatment, because I'm one of the doctors that you've seen numerous other specialists before you've come to my office. And they've seen wonderful specialists who've treated all of these disorders. But a lot of times mold is that missing piece of the puzzle and can perpetuate these other conditions. So how does mold even cause inflammation? So once mold toxins enter the cell, they start this inflammatory process and makes it more of a challenge for the body to detox. So it starts to colonize the sinuses and the GI tract. And that's one of the reasons why patients can continue to have toxicity even if they're out of that moldy environment, because of that colonization of mold. So mold can also cause brain inflammation. So this area called the hippocampus, which is the area of the brain that governs memory, learning, and your sleep-wake cycle, it's typically inflamed by mold toxins. Another thing that happens as it relates to mold toxicity is you have something called decreased neurogenesis. And that simply means you don't generate new nerve cells. That can lead to problems with focus and concentration. And I have so many patients who tell me they just can't learn new things. So decreased learning of new knowledge. Here are some other neurocognitive symptoms associated with mold illness. So we see memory loss present about 70% of patients. Here at Amen Clinic, we actually have a memory rescue program. So our memory program is based on Dr. Amen's book, Memory Rescue, where we look at underlying causes of memory impairment and try to treat dementia, Alzheimer's naturally. But the key to that is understanding what the root cause is. And in so many patients that I see who suffer from cognitive impairment, it's due to the overproduction of mold toxins. And so treating those mold toxins, one of the goals is that it will help to foster improved brain health. Patients have extreme mental and physical fatigue. I mean, it's that debilitating fatigue where you can't get out of bed, you can't be physically active, your mind is just shutting down midday, headaches, migraines, attention problems, executive functioning deficits, mood like anxiety, depression, and OCD, and also visual changes. One key system that is negatively impacted with mold illness is something called the limbic system. Now, this system in the brain is responsible for our constant fight or flight response. And when it's stimulated, when your body is under attack, it feels like it's under attack, like you're being chased by a bear 24 hours a day, 7 days a week, even while you're sleeping. And as a result, people who have this limbic system overreactivity are very sensitive to things. They're highly sensitive to a wide range of things, including scents, medication, supplements. It can sometimes be stimulated by an emotional trigger or by barometric pressure changes. But these are the patients who come to my office and they cannot tolerate anything. Probiotic, foods, perfumes, all send them over the edge, all cause them to be in that constant fight or flight response. But it's usually the toxin that kind of primes the brain for what we call this cell danger response. So what happens there is that your brain feels like it's under attack, but they know it's danger and can't determine what that danger is. So as a result, it's this vicious cycle of kind of what we call cellular injury. Your cells are injured, but they're not healing because your body feels threatened. Your body feels under attack. And once we find out that those stressors, like with mold or other environmental toxins, then that limbic system can calm down. Some of the functions of the system, it integrates sensory information, it kind of sets that emotional tone, sense of smell, libido, memories, histamine cells that we'll talk about later, called mast cells. They are found there. So when the limbic system is overactive, because these mast cells produce histamine, and histamine causes allergies, people are more likely to have allergic reactions. It also can affect the autonomic nervous system. And some of the things that the autonomic nervous system stimulates is our blood pressure. So I see a lot of patients who have dizziness or high blood pressure or what's something called POTS, which means from lying to standing, their blood pressure changes and they get dizzy. And there are some treatments that have been created for limbic system overreactivity. You have to all understand what the stressor is. That's very important. But then there's something called neural retraining system that is a program by Annie Hopper, and then neurofeedback. Both of those methods have been shown to calm the limbic system down. And so now those patients are shift out of that danger, that cell danger response, into more of a calm response. And then you're able to treat them with therapeutic intervention. Because a lot of these patients don't get better due to the fact that they can't tolerate any sort of therapeutic intervention because they have adverse reactions. Dr. Dale Bredesen at UCLA, he's an Alzheimer's disease researcher. And he published in 2016 that mold, that a significant number of his dementia cases actually had mold and they weren't Alzheimer's. And in this paper, he showed a link between the exposure of toxins to Alzheimer's disease. There was another study in Dallas where they had 100 participants that were examined, and they wanted to discover how mold exposure led to cognitive and emotional impairments. After the mold exposure, there were nervous system challenges in all 100 of the participants in the study. This study also did brain SPECT scans findings, and they identified abnormalities in a significant portion of these patients, specifically in that limbic system that I referred to earlier. They also looked at neuroquant imaging, which is a special brain imaging that Richie Shoemaker has created outlines and an algorithm that shows if a person's brain is impacted negatively by mold or by chronic tick-borne diseases. Now, my alma mater, Brown University, they did a study in 2007 where they looked at linking mold into anxiety and depression. So what they determined was that the toxins can affect the nervous system or the immune system and impede the function of what's called the frontal cortex. Now, the frontal cortex is the part of the brain that's responsible for impulse control, memory problems, sexual behavior, spontaneity, and socialization. 40% of the residents lived in a visibly damp, moldy environment, and they had a significantly higher rate of depression than those in the mold-free dwellings. And they concluded that moderate exposure to mold led to a higher risk of anxiety and depression. So mycotoxins, mold toxins, become neurotoxins. So when toxic black molds grow, they produce all these different byproducts, which are toxic to the brain. Imaging has shown that many mycotoxins cause lesions in the brain's gray or white matter. And that once again affects the frontal cortex, which causes what we call dopamine dysfunction. And when dopamine is low, that's going to lead to psychological disorders like anxiety and depression. So there's a direct correlation with mycotoxins and lower levels of dopamine. So what happens is dopamine becomes slowly destroyed, and without dopamine, the brain can't properly send the signals, send those messages that keep your mood stable. So here are some of the common psychiatric symptoms of mold that I've seen and that have been reported in the literature. Sleep changes and insomnia is very common. Irritability, these explosive rage, we call it mold rage episodes. I also see it in my patients who have chronic Lyme disease and tick-borne diseases. Depression and sudden mood swings, panic attacks, like these intense panic attacks where they're short of breath, having air hunger. I've also seen psychosis, delusions, hallucinations, and this feeling of electric shocks. Mold can affect the hormones. It can cause something called it can cause adrenal fatigue. And when your adrenals are suppressed, that's going to lead to decreased levels of hormones that are required in order for brain stabilization and healing. So some of the common abnormalities found with mold illness, you have low sex hormone production. And so you have irregular menses, or some women may go into premature menopause, low testosterone, low libido, lack of energy. And then that stress hormone, cortisol, is also imbalanced. So what we typically see is that the cortisol level shoots up. And so patients are in this sense of stress. And I call it the kind of the wired but tired response. So you have all this, what you feel like is energy, but really you're more tired and exhausted because of the adrenal fatigue. And over time, mold can lead to complete suppression of cortisol. Leptin can become abnormal, and this hormone specifically tells the brain to provide weight loss. And when it's impaired, you're going to have an inability to lose weight despite exercise or dieting. You're going to have a suppression of melatonin, and melatonin is needed so you can get a good night's sleep. And if your body isn't sleeping, your brain isn't healing. And then this hormone ADH, which is antidiuretic hormone, that can also become suppressed. And when that's low, patients complain of excessive nighttime urination, bedwetting, and then the susceptibility to shocks from static electricity. That's usually the main culprit for that, is the decreased ADH. Mold can suppress what's called endorphin production, and that's going to lead to chronic pain. And sometimes it's unusual pain because it's not a typical location. It can be migrating, it can be on one side, it can be joint pain, muscle pain, fibromyalgia. It can be associated with headaches or migraines. But what I have found through the years is that treating biotoxin illness has allowed for a lot of my patients, a large percentage, to be able to remove pain medications from their regimen because that's what we call treating the underlying cause. Dr. Shoemaker developed a visual contrast screening test. Now, this test is a screener for biotoxicity, and it can be found on his website, Surviving Mold. What his literature shows is that failing the test makes mold toxicity very high on your differential diagnosis. All right. Passing the test doesn't mean that you don't have mold toxicity, but it's more important to know if a patient fails or not. So I tie mold into what I call the M&Ms. I alluded to earlier how mold makes everything worse, but it also makes a key abnormality called mast cell activation syndrome. It's a key trigger there. And mast cell activation syndrome is histamine intolerance. But also mold can affect multiple infections, including bacterial, yeast, parasites, viruses, and it can initiate that cell danger response when your body feels like it's under attack and under stress. So what is this mast cell activation syndrome and why is it important? Well, mast cells are a very, very important part of our immune system. These cells release histamine, and histamine is what's released when we have allergies. That's why we have antihistamine medications. But the problem is that when the body is under attack, may that be from what we call an activator, and a common activator is mold, yeast, bacteria, viruses. But when I say that M&M, when I have a person who has high histamine and mast cell activation, I have mold really high on that differential. And so what happens is that that activator comes in the mist, and those cells that contain histamine and 50 other mediators, they just break down, and they break down uncontrollably. And that's where you start having the symptoms. And the majority of these mast cells, they're located in that limbic system. So limbic system overreactivity, that fight or flight response that I referred to earlier, is exacerbated by mast cell breakdown. But you can also have some of these symptoms we listed here, like general symptoms of weight loss, fatigue, chronic fatigue, respiratory symptoms, shortness of breath, some of those allergy-like symptoms. Neurologic, I see a lot of patients with insomnia, anxiety, depression. There's actually some histamine medications, antihistaminic medication, one of which is Visceral, that lowers histamine and is prescribed very often for anxiety. Because we see that lowering histamine levels can help with decreasing your anxiety levels. Musculoskeletal, these bone aches and pains. The gut can be leaky or irritable. Skin issues can occur, and then changes with blood pressure. So one thing that happens with histamine, they're kind of like immune sentinels. They are in our bodies to alert us of positive dangers, possible or potential dangers. And at elevated levels, that's where it starts to create those mental health conditions: insomnia, anxiety, depression, depersonalization. And here are some of the common allergy symptoms associated with mold. Chronic sinusitis, like this postnasal drip. I have a lot of patients who present with postnasal drip and chronic cough, but it's not productive. Patients who lose their sense of smell due to congestion, sinus headaches, And then I also do a lot of nasal cultures in my practice where I evaluate for colonies of bacteria like resistant form of Staph marcans or mold and yeast in the nose. And I can do that by looking at DNA samples of those nasal swabs or by culturing for something called methicillin resistant Staph aureus or marcans. Now, testing for mold is important in the body. So some of the tests that I tend to rely on urine mycotoxin testing. And there are two that I use commonly. There are other tests that are commercially available as well. But these are just two of my favorites. So real-time labs is what we call an ELISA test. So it's going to measure for toxins and it's going to measure for metabolites. And here are the 5 toxins that are screened for with real times. The other test that I use is Great Plains Laboratory for urine mycotoxin. And it's not, you can't really compare the two labs because they have two different methods for collecting their data. This one, Great Plains, uses what's called mass spectrometry. So it looks for these toxins produced here, and they will give you a range, just like with the real-time labs, of what's toxic, and specifically give you more educational information of some of the systemic symptoms associated with these biotoxins. And this is just an example of a mycotoxin test, one of the tests where if you look at the black bar here, that's just letting you know the level, the results of that toxin. So it typically gives you a normal range and then the patient's results. So usually like for here, 4 to 20 is normal. This patient is 55. That's significant. And this is another one, this one, Chaetomium globosum, 20 to 80 is normal, and this person has 779 as their score. So I tend to use urine mycotoxin testing for the diagnosis of circulating mycotoxin in a patient. And also I monitor them as they go through treatment, usually 6 months or so after they went through treatment. I also use those Ritchie-Shoemaker inflammatory markers that I referred to on that biotoxin pathway, which lets me know if there are inflammatory toxins by the mold. So as stated, you may not be in a moldy environment. The mycotoxin test can be completely normal, but then you want to check for that overall level of inflammation so you can do the Ritchie-Shoemaker biotoxin lab markers as well. You have to make sure you screen your home and you remediate your home and that you remove the mold because you want to support the liver and remove mold from the cells and bind them. So there are numerous strategies to treat biotoxin illness, but the most important one is making sure it's not in your environment. And you also want to make sure you support numerous areas in the body that need to clear mold. So if mold has been shown to be colonizing the nose, you want to use nasal management. And these are just some examples. You can do over-the-counter sprays like silver spray, restore nasal spray, antifungal sprays like itraconazole, which you would get at a compounding pharmacy, or the antifungal vancomycin. You can use chelating agents like EDTA, antibiotics, nasal sprays, bag spray. And I've started to see more and more research in probiotic nasal sprays as nasal management of mold colonization of the nose. Also antifungals. You can use prescriptions, herbals, making sure patients are on kind of Saccharomyces probiotic like a Floromyces or a Fluorostor. You want to do dietary changes, so decreasing the mold that you're introducing into your diet. And then there are a whole host of supplements. Now, the key thing to understand when you're treating mold, we need that liver to work so that we go through those two different phases of detox, phase 1 and phase 2. We need gallbladder support. And if a person doesn't have gallbladder, that what's called biliary tree. We need support from that. So we have the proper amount of bile. And we need to make sure the environment is clear. Now, one thing that I used to do years ago, because I didn't quite understand as much as I do now as it relates to liver and gallbladder support, is that I would say, oh, the person has mold, let's start them on what's called a binder. Now, binders attach to mold toxins, bind them with the goal of pulling them out the cells, adhering to them, and having you allowing for you to excrete the mold toxins in the stool by traveling through the intestine. Well, what I found out is that if I'm binding a person, but I'm not giving them the right liver and gallbladder support, or if I'm using these binders like these prescription binders, well called cholestyramine, or the numerous natural binders like charcoal and zeolite clay, bentonite clay, okra, chlorella, but I'm not clearing it, then I can have more of a problem because I'm pulling mold out of the cells, but they're circulating in the body. They're free floating, circulating, causing that tissue damage instead of being excreted through the stool and through the urine. And once I figured that balanced approach, that's when my patients started to become healthier. And those mold tests, the urine tests started to improve because, in a sense, without giving the right gallbladder and liver support, you're just going to cause more harm than good. You're going to have those toxins just circulating without being cleared. And that's going to lead to even higher inflammatory burden and even more neurological inflammation. And a key sign that a person doesn't have the adequate liver and gallbladder support or drainage is the patient who gets extremely ill once you start them on a binder because it's overwhelming. It's kind of like a Herxheimer response is what I call it, like a die-off reaction, this high inflammatory burden, but just due to a high level of toxins being released and not being excreted. And you also want to make sure a person has optimal gut health when you're treating bile toxins, because if the goal is to remove these toxins through the stool and the urine and a person is constipated, then that's also going to lead to a backup in these circulating toxins indefinitely in the body. And some of the common things, side effects of binders is constipation. So that's why having a physician who does a really good comprehensive gut workup and protocol while you're going through mold treatment is essential. So here are some nutritional strategies, trying to incorporate foods that help remove mold, because food is also your medicine. So things like walnut, cruciferous vegetables, turmeric, cilantro, citrus fruits, salmon, berries, removing fermented foods. We all know that fermented foods are very helpful as prebiotics, but they can also have mold derivatives. And we also want to limit mushrooms. We want to increase good fats in the diet, like avocado, omega-3. And those leftovers, they need to be frozen to be used later or discarded after 48 hours. You want to remove as much as possible those inflammatory foods like dairy and gluten and sugar, because in a sense, you're adding more fuel to the fire. And that inflammatory burden is already high. The body is already on fire due to mold illness. So you want to make sure you're not introducing foods that are going to increase that inflammatory burden, okay? Some of the other strategies that have been published to improve detoxification. There was literature that showed that hyperbaric oxygen therapy has been helpful at helping to remove specifically ochratoxin and gliotoxin. And what a hyperbaric oxygen therapy is when you get over 100% of oxygen, and it's kind of the ATA pressure is the equivalent of deep sea diving. So however, the ATA is how deep you are under sea level, and a higher oxygenation is provided to the patient. And that helps with the clearance of toxins, especially neurological toxins. Infrared sauna, so using far infrared sauna and lighting, has been published in literature for Switzerland to be great at removing mold. And then Epsom salt baths, just some good old Epsom salt with magnesium, allowing the body to detox, opening those pores, is also a useful form of detox so that we can get rid of this thing. Now, here's my contact information if you have any additional questions or comments, or you just want more assistance as it relates to evaluation and treatment of mold illness. I hope that this has been helpful. Some of the take-home points: mold should be on your list when you have a person who has nebulous symptoms of unknown causes. May that be mental illness or cognitive impairment, pain, chronic sensitivities to multiple chemicals. You got to think about mold. Making sure the environment is clean is the first step to mold management. Also, making sure you remove mold toxins from the liver by assisting the liver and gallbladder with detoxification, and from the cells so that you can get the mold out the body. That's crucial. Doing the right test and asking the right questions is imperative, and tracking progress. Um, it works. People get so much better. So have a good day and thank you for your time.